Hello, I am Dr. Ali Sami GÜRBÜZ. I work as an obstetrician. I started working as an obstetrician in Konya in 2003. I was a freelance doctor in the first years, and now I have been at the Novofertil Fertility Center for about 10 years. Here at the center, we assisted the birth of thousands of children. For the past 3 years, I have been simultaneously carrying out my role at the in vitro fertilization center while also delivering gynecology classes at the Faculty of Medicine in Karatay University. In vitro fertilization is one of the fastest progressing areas of medicine. Micro-teeth surgery has entered our lives in the past 15 years. Along with micro-teeth, micro-injection procedures have emerged, which contributes to the increase of pregnancy rates. In addition, embryo monitoring systems such as embryoscopy have also recently been developed. Genetic in vitro fertilization applications, which we also know as pre-implantation genetic diagnosis, started to be implemented. Along with these, we also perform blastocyst transfers. We develop the embryos until the 5th day after fertilization and then transfer them from there. We have yet another application called embryo shaving, where we file and open the outer membranes of the embryos, which is done to make it easier for the embryo to stick onto the uterus. However, there are also methods that have been introduced recently into our lives and have been utilized, but there are questions regarding its effectiveness. One of them is extracting sperm with the help of microchips. There are platelet-rich plasma applications for the ovary or uterus. There are also some studies on the use of lymphocyte immunization or uterine or pregnancy immunization. From time to time, we employ these methods in our clinic, but these techniques will enter our lives after they have been fully deemed safe. Pre-implantation genetic diagnosis is a genetic examination of small samples taken from the embryo before transferring it to the mother. We view this in 3 groups, the first of which is single gene diseases. If there is thalassemia or any other hereditary disease in the family, we can prevent these diseases from passing on to the child. When we look at the second group, we should see one part of the chromosome stick to the other. So, for example, there is a group called translocation. In this group, we receive the biopsy of the embryo and we look at whether these chromosomes adhere to the other, and we transfer them to the mother accordingly. Another application is when we find no problems or defects, but we want to transfer the embryos with normal chromosome structure to the mother. We have made a genetic diagnosis regarding this issue. This is referred to as a screening. The name has changed over several times over the years. It was PGD, now it's PGS or PGTA. When we look at them all, it is an application we can use to evaluate the number and shapes of chromosomes. Who are we doing this to? We use it especially if we have had repeated failures, that is, if several in vitro fertilizations were performed but the family was not able to have children. Or we use it to increase in vitro fertilization success in older couples. For example, if there is an old-age woman wanting to have a child, then in vitro fertilization is performed. In addition, even if no issues have been detected in the family or relatives, a concern like Down syndrome can be encountered. As a result, if people have anxiety and fear, we do PGTA to eliminate their concern.